around. So you're gonna take the blood pressure. You're gonna use the blood pressure apparatus. This is an Android one. So as you can see, there's gonna be left arm, right arm. So that's where the artery is. Wherever the artery is, you want to position your stethoscope in that area. So left arm is gonna be here. But mostly you can just put it in between here. You're a safe bet. Without the shirt will be better. If you cannot, then you can do the shirt, but then it's not gonna be as accurate. I'm gonna just have it down snug, okay? And then here, this is for this, right? You can flip this here, or if it doesn't have this, just clip this here, all right? So in this case, we do this. Just relax your arms, relax. Just have to get them to straighten, so expose the artery there. And then this, you're gonna be, everybody familiar with this, you can test it. Make sure you're on the correct side, because this turns. So you have the drum, like a bell, and then you have the flat one, okay? So make sure this is facing this way, not the other way. You're gonna have a hard time hearing if it's the other way, okay? Do that. This one, test it. And when you rub it, you're gonna hear, and then put this where the arrow is, all right? Insert it there. You wanna use your index finger, and then you turn this off. So I place it there, and then you're gonna go up. Now, how high do you go up? It depends on what you think the blood pressure of the person is. If they're hypertensive, sometimes you really have to go up 160, 180. If you, let's say, because you're gonna be listening for the beat. If you're, let's say you pump it and then you still hear the beat, you have to go higher. So when you're doing this, so let's say you're going to pump, and then you open the valve, slowly release the air, and then you're gonna hear the heartbeat. The first one is your systolic, that's the top part. And then the second one is the diastolic, so that's the second. Remember, the blood pressure is 120 over 80, let's say, for example, right? The first beat is the 120, and then the second one is the bottom one. Okay, so for her blood pressure 120 over 80. I started hearing the beat on 120, slowly, and then it disappears at 80, and then you can turn on the open the valve fully, so you deflate that. And if you want to try again, you can try a second time to deflate it, try it again, but you don't want to try too many times. Then your results are not going to be accurate. Okay, they actually, if you want to be strict, they don't want you to try 2 consecutive times. If you're not sure, try the other arm also. All right, to rest this arm. Now, if you're going to do it by yourself, which what we were discussing earlier, this is how you're gonna do it. So first is, I'll show you how to do it by yourself, and then also you can actually take your blood pressure without the stethoscope. You can only get your systolic though. All right, but that gives you a pretty good idea. What's the systolic and the diastolic? The systolic is when your heart pumps, that's a pressure. The diastolic is the resting one. If the bottom is high, that's dangerous. Well, the top one is dangerous too, but the bottom one, the lower, you don't want it too high on that one, okay? Now, if you're by yourself, what you want to do is, especially if it's flat, it's easier. This one's a little more difficult. Do this. Put the stethoscope in your ear. Basically, you just, or you can just do this. Insert it in there. Do that. When you have that, you'll be able to pump it. And this, you can put on a table, right? So you'll see the gauge, and then you'll be able to pump it. The thing is, you have to make sure that this is inserted, okay? Because with the bell, it kind of pushes out. If it's flat, it's easier, right? But even with this one, even with the bell there, you kind of put it in, and then let's say for her, only gonna go 140, it still stays, and then you're gonna, still listen, and you're still gonna hear it. Okay, so you guys can try that, and you can try amongst yourself. You can practice that. Now, what if you don't have this? You don't have that. What you will have to, or one thing also is, if even if you have this, sometimes I look at the person when they're taking it, I know if they're accurate or not, because you can see the needle start jumping, right? When your heart starts beating, like whatever that pressure is, it might be off a little bit, but you're not going to be off by a lot. It's not going to be 10 millimeter mercury off. So let's say, for example, it's this. You do it slowly. In her case, it starts jumping already around here. You see that it's already jumping, right? So it might be off by, like, say, less than 10. But you know they're not gonna give you something crazy number, and then it stops here. So that gives you an estimate. It's not accurate, but at least gives you an estimate. The person really knows what they're doing. So that's one. Now, if you don't have a stethoscope, you can actually gotta feel the pulse here. You get the pulse, and what you do, you pump it. All right. Once you pump it, pulse is gonna go away because the pressure is gonna be too much for the heart to actually pump the blood. Then when you start opening it, whenever you start feeling the pulse again, then you actually start, that's your systolic. That's the pressure where your heart can pump the blood to your extremities. So in her case, it's actually around 110 to 120. Okay, then you don't get the diastolic, it's not gonna stop. But this gives you an idea of what your systolic is. Most of the time, that's what you look at when you have patients. You know, they're gonna have a stroke. Usually, that's the first one you're gonna look at. If the diastolic, the bottom one, is regularly high, person's gonna be in danger for having a stroke, because then that means the pressure is always high. The first one is when the heart pumps, it's high. When you exercise, it shoots up, right? But the other one is even when you're resting, it's still high. That's even more dangerous. When the bottom one is high, that's worse than when your first one goes high. Because the first one, we expect that to go high, but we expect that to go down also. All right. So now you know how to do this yourself. You can get something like this from Amazon. Get the flat one, insert it there. This is more accurate than having the digital one that you're gonna use. Okay. All right. You guys want to stop that? You guys want